Okay, so you guys can grab your new PowerPoint, your blood pressure PowerPoint, and we are going to go over just kind of the information on here today. I'm going to do the procedure when I get there with you guys tomorrow, on Thursday this week for my students. We'll do the procedure in a separate lecture. I just wanted to go ahead and go over this so we have plenty of time to practice the procedure as we learn it. Okay, so blood pressure. You can find this information too in your textbook on page 329. But it's just what we're looking at with blood pressure. So we've talked about our vital signs: temperature, pulse, respirations, oxygen saturation. Now we're on to blood pressure. So blood pressure really just shows you the amount of pressure that's exerted by the heart on the walls of the arteries. If you remember, arteries is what carries blood away from the heart. So that's what carries that fresh, for the most part, usually carries freshly oxygenated blood. It has a pulse. Okay, so there's lots of pressure there. So there's two numbers. You guys have seen blood pressure before. You know, normal blood pressure is like 120 over 80. Okay, systolic blood pressure is during the contraction of the ventricles of the heart. So it's when the heart is squeezing. So that is going to be your higher number. That's the number that's on top when you're looking at a blood pressure. Diastolic is during while the pressure in the arteries that remains, even when the heart is relaxed. Okay, so that's the lower number. So if you're looking at 120 over 80, 120 would be the systolic blood pressure, 80 would be the diastolic blood pressure. Okay, whenever you document blood pressure, you always want to make sure it's measured in millimeters of mercury, abbreviated mmHg. So it stands for millimeters of mercury. You guys know mercury on the periodic table, Hg. Now, the reason that we measure it in this is actually, let me show you guys. Let me grab my other blood pressure cup. Okay, so the blood pressure cups that we used to have looked a little different than the ones that we have now. The ones we have now are called aneroid blood pressure cups. But the ones that they used to use were actually mercury blood pressure cups. Let's see. My camera down a little bit. All right. So, if you guys can, hold on. There we go. Okay, so you guys may not, let me see if I can zoom in on this. There we go. Okay. Oh. Okay, so this is a mercury blood pressure cup, same as normal. You put the cup on your arm and you pump it up. Okay, but you'll notice on here, and I think you guys will be able to see it. Okay, everybody see how, let's see, not really made to go right here, but I just want to show you guys the mercury in here. See, everybody see how that's moving? This right here is moving, and there's numbers all along the side right here, okay? And so what it's doing is it's actually, there now you can see a little bit better. This is mercury, and these are measured in millimeters. So this is how it takes that pressure. And let the air down and it'll go down. So anyways, you'll learn how to actually read it in the next couple of days, but I just wanted to show you kind of why. I know that sounds like a weird measurement. You're like, millimeters of mercury, what does that even mean? Well, this is why it's measured in that. Okay. Get this right here. So anyways, just wanted to show you guys that. You can see why it's called that. Okay. So, of course, it's documented as a fraction like we talked about earlier, the systolic blood pressure on top and the diastolic blood pressure on the bottom. So here's a couple of examples. Okay, so expected values for adults. Normal expected systolic blood pressure, somewhere between 100 and 140. I would even go to say, you know, like 95 to that. Normal expected diastolic, according to the book, is 60 to 90. So some lower ranges can be expected as normal, but not really higher than that. Like my blood pressure normally runs 90s over 50s, and that's my norm. Okay, but generally speaking, anybody over 135 consistently and over 90 on the bottom consistently is going to be diagnosed with hypertension. So these are your normal ranges, systolic and diastolic. Okay, so hypotension, so that means low pressure. It can cause dizziness, lightheadedness, can cause confusion. If you guys have ever been laying down or sitting down for a really long time and then you get up really fast and you kind of get dizzy, that's usually related to your blood pressure. It's like a little drop in your blood pressure. Severe hypotension tells you that they could be going into shock. So that's one sign, especially for somebody who has been in like a traumatic accident or has had some kind of, you know, major blood loss. A sign of them going into shock is a decrease in their blood pressure. Other symptoms of that someone's going into shock is a change in their level of consciousness. That's what LOC stands for. Increased heart rate and respiratory rate, a weak, thready pulse, so it's like you can barely feel it, and then pale or sweaty skin. Those are other signs of shock, but hypotension is definitely one of those signs. Blood pressure sites, so places where we can take the blood pressure. We have brachial, that is where you put the cuff like you normally think of putting a blood pressure cuff up here on your arm, and then you use the brachial pulse. It's right there, kind of like the bend of your elbow. Radial is where you would put the cuff on your forearm and check a radial pulse. Popliteal, you would actually use a thigh cuff, so a cuff would go around the thigh, and they make thigh cuffs. And then use the popliteal pulse, and then the dorsalis pedis or posterior tibial, you'd put it on their calf. We used to use calves a lot for little babies, like when they came into the emergency room, you'd wrap a blood pressure cuff around their calf, and that's how you check their blood pressure. Okay, the equipment, excuse me. The equipment that's used is a sphygmomanometer. Sphygmomanometer. It's spelled, it's said exactly like it's spelled. Except not here, because I misspelled this. Here we go. Sphygmomanometer. There we go. Sphygmomanometer. So that's what we use to measure. This is a sphygmomanometer. This is a mercury one. The aneroid ones are the ones that have a little dial on them. Okay, that's the ones, at least I'm assuming that from other schools too. That's the ones that we have here in the classroom. So it includes a few things. Okay, we have the cuff, of course. It goes on your arm or thigh or whatever. All of ours are arm cuffs, so that's what we're going to use it for. The bulb is the part that you squeeze. Okay, the valve is the valve that's on the bulb. It's usually at the top of the bulb. That's the valve. Okay, and it opens and closes so that you can put pressure in or let it out. And then the dial is just the part that has the needle in it that tells you what numbers you're looking at. So again, there's different types. You have the mercury ones like this one. We have the aneroid ones that have the dial, and then the electronic ones, like ones that you might use at Walmart, when you go and put your arm in, or the ones that are on the wrist. That's another type of electronic blood pressure equipment. Now I'm going to go over the specifics and how to use each of these as we do the procedure over the next couple days. So we'll learn that, but I just wanted you guys to kind of get the basics, and we'll learn that. So anyways, if you guys have any questions, write it down and you can ask me.